All right. Good afternoon. It is 5 o'clock, that time that we come together, get an update on where we are in fighting COVID-19, but also recommit ourselves to doing what it takes to protect one another, to continue to flatten this curve, and to defeat this worldwide health pandemic. We're here today on a Sunday, and for the first time since our very first case, we did not provide an update yesterday. I was trying to live out what I've asked everybody else to do, is be in a good place with your mental, physical, and emotional health, and make sure that every day we have the strength and resilience to do what it takes to win in this crisis. So thank you for giving me that one day and that one opportunity to refuel a little bit. So let's start the way we always start, by knowing and by saying that we will get through this, and we will get through this together. Say it with me. We will get through this. We will get through this together. One last time. We will get through this. We will get through this together. And we will get through this together because by now it's becoming muscle memory about what it takes to defeat this virus. Those are the 10 steps to defeating COVID-19. And folks, these aren't just 10 steps that we keep talking about for no reason. These are the 10 steps that, even according to the UK study, have saved thousands upon thousands of lives. We actually believe the number of lives saved to date is even higher than that study. And that's because of you. There's a difference between putting rules up on a screen and living them, and you have been living them. So it starts with healthy at home. Even as we start to do some reopenings, healthy at home is how you save other people's lives, and it's what you've been doing. Healthy at home is how you protect yourself and your family, so let's continue to keep that up. Remember, you can get outside, get exercise, but just stay with your own family unit, and let's make sure we continue in the midst of this, because this won't be with us forever, but we've got to change our lifestyle like we have until we ultimately have a vaccine or other types of treatments. Avoid crowds and gatherings. Practice social distancing. Know when to seek care. kycovid19.ky.gov. This is the source for all official information. For instance, tomorrow our guidelines, our requirements, because they're requirements, not guidelines, on the first set of reopenings by industry are going to be up on that website. Washing hands and surfaces. I mean, this far in, we might think that that's less important, or we might do it less. It's more important. We got to continue to do it more. Continue to apply for benefits. Prioritize your mental health. Hopefully I lived that one out a little bit by telling you that just like you need a break every now and then, I did too. Don't travel, and report your noncompliance. And that's going to become important, especially as we're able to open more things up. So we always talk about 10 steps plus one. Fill out your census. You all have been doing a really good job up to 13, so I'm not going to spend a lot of time on it today. But we need, if you haven't filled out your census, just takes a couple minutes, incredibly helpful for everybody in Kentucky. Let's make sure that we get this done. We also ask each day, and through this weekend, it's been fun to see, for everybody to take this new normal that we're living and model out the type of good behavior, the good news that you can on social media using our hashtags. It's a chance to show that we can still have special moments. We can still be together, even if it is virtually, that we can still do so many things, even during a 1 in every 100-year type of event or occurrence. So let's look at a little bit of what we've had over this Derby weekend. Here is worshiping virtually at the Next Chapter Church. So many, all but one that we know of, churches in Kentucky protecting their congregations, worshiping virtually or through drive-in, drive-through services. We appreciate that. It means you are protecting the members of that congregation. And today at our service, My minister started off saying that they were going to look at the entire situation of the reopening plan, and just because there was a date that they could reopen doesn't mean that they will at that time. He and I know so many others out there are just making sure that when they are able to do this, that it is safe for everybody in that congregation. What's next? All right. This is Kentucky Derby Party, social distancing style. Just an opportunity, again, staying safe, not coming into contact, to be able to see those we love, those we care about, and to enjoy a little bit of the virtual Derby, where, thank God, Secretariat won, because we would have had some real problems here in the Commonwealth had the greatest horse of all time not won that race. What's next? Oh, it's pretty neat. Admittedly, my kids have set up something like this too, even though they're a lot older. But our kids show us that we can't sit around feeling sorry for ourselves. This is our challenge. This is our time. We're going to deal with it. We're going to defeat it. We're going to come out stronger, and we're going to save lives in the process. Oh, I love stained glass. We've talked a lot about chalk art, but we're seeing this all across the Commonwealth too. Again, it's our kids showing their creativity, using their imagination, and it's been almost a reemergence of more public art, especially by our kids, than I think we've seen certainly in my lifetime. So here are some of, again, those great frontline heroes. This is showing you drive-through testing. And to give you an idea, this is a professionally administered test. So what happens in the Krogers is you administer them yourself. This is one that we believe has the highest accuracy. It is also really uncomfortable, but it is one that we still need to be able to do, especially for our first responders, our healthcare workers, and those that are symptomatic when we can. This is U of L and Norton's partnering together, and we need to see more of this. So the state is going to continue to ramp up our testing capacity, but every private or not-for-profit or university that can add to that capacity is only going to help make us safer as we take our next steps. This is another recovered Kentuckian who defeated COVID-19. It's pretty excited. 90 years old. This is Kristen's mama, Miss Bradshaw, and it's pretty exciting. And we got through this. We got through this together. We are thrilled for them. We're thrilled for every recovery we have across Kentucky. Very special. And here's Bardstown, again, lighting up their courthouse green to honor those that we have lost, to remind everybody that no one is alone during this. We are all together, and we're going to make it out of this. And that green, the color of compassion and renewal, not just helps us now, telling people that we care, but also reminds us of that better day ahead. All right, and so today, we hadn't thought or hadn't talked previously about what we were going to learn on signing, but this is important because it's something that helps everybody to be a part. We're all in fighting this virus together, and I'm glad that we came together and found a way to include everybody in these briefings. So how about today we learn... Well, we learned mom and dad. How about we learn brother and sister? Okay, brother, sister. Oh, sister. Got it. Okay, brother and sister. Thank you. Helping all those families hopefully now. Again, learn a little bit more. My kids could argue with each other with everything they've learned. That would be helpful. I want to go right into the numbers today, and then we're going to talk about the other things on our list because we have 2 days' worth. We have Saturday's report and Sunday's report. I will tell you Sunday's report was based on very few tests on how the labs report. But Saturday's report overall is very stable with what we have been seeing with 173 new cases of COVID-19. Those 173 come 27 from Jefferson County, 25 from Boone, 19 from Warren, 18 from Fayette, 17 from Davis, 16 from Kenton, 6 from Muhlenberg, 5 from Grayson and Hopkins, 4 from Grant, 3 from Campbell, 2 from Butler, Henry, Logan, Meade, Ohio, and Shelby, 1 from Anderson, Bullitt, Callaway, Christian, Franklin, Henderson, Letcher, Livingston, McCracken, McLean, Monroe, Nelson, Oldham, Perry, Simpson, and Webster. And so overall, that number, again, is right around what we've been seeing, even though our testing has ramped up, and even with us testing a lot of populations where we have expectations that people will test positive for COVID-19. So we're digging down into some of that data right now, but again, it suggests at the worst we have plateaued, and maybe when we look at the rate, it's even a little bit better than that. But remember, this is all based on what we were doing 2 weeks ago in many ways. That you all have done such a great job at living those 10 rules, at living for each other in so many ways. That we have seen, again, something we've never seen, I think, in history when we look at these pandemics. You are saving thousands of lives. I'm very proud to be your governor, and I'm very proud of you. We did, however, on Saturday's number, lose 5 additional Kentuckians to bring our total number of Kentuckians we've lost to 253. Those 5 individuals who will be missed by their families and their communities include a 90-year-old male in Jefferson, a 79-year-old female in Logan, an 81 and a 90-year-old female in Adair, and a 99-year-old female in Jefferson County. Again, let's make sure we light our homes up green, our institutions, our places of work. Let's ring our bells at 10 a.m. every morning because these families and all of those 250-plus families need our help in this time where grieving is especially hard and not being able to be close to so many people that you would want to. Moving into Sunday's numbers, again, this is in part because of the number of tests that actually came in. But for Sunday, we are only reporting 80 new cases of COVID-19. This is one of the reasons that we average because no day right now just has 80. We know that. Just like no day really had 300 and something. It was all in around the same numbers that we're seeing, even though we're testing more people. That brings, after we remove duplicates and others, the total number of cases that we're reporting as of today as a state, 5,130. Now, that includes 5,129 lab confirmed positives and 1 probable. And when we look at the areas that those 80 are from, it's 25 from Jefferson, 15 from Fayette, 6 from Davis, 6 from Kenton, 6 from Warren, 5 from Grayson, 4 from Hardin, 2 from Henderson, and 1 from Barron, Boone, Carter, Christian, Graves, Greenup, and Muhlenberg. Total number of tests to date, at least 58,408. It's going to shoot up a bunch next week with the kits that are coming in. Ever hospitalized, 1,519. Currently hospitalized, 329. Number of patients ever in the ICU, 654. Number of patients currently in the ICU, 170. That's down a little bit from 2 days ago. That is good news, but that's still 170 people that need your thoughts, prayers, families that need your help. The number of patients that have recovered, 1,892. We love seeing that number go up every day. And for this Sunday, based on times of reporting, I get to announce 0 new deaths. And we know that there have been people that were I counted either on Saturday, and I already know of at least one death that is going to be reported for tomorrow. But just for one day, even if it's just the official count, that feels pretty good to read. Now, tomorrow, we're going to have numbers in on Green River, which is a state prison. And we believe that as those come back, they're going to be pretty tough numbers to see. So we're going to talk tomorrow, once those come in, about our action plan moving forward. 5,130 cases, 253 total deaths to date here in the Commonwealth. As we break down race of known cases, it's about 74.88% white, 13.35% Black or African American, 6.25% Asian, and 5.37% multiracial. And then of the ethnicity of cases, it's 89% non-Hispanic and 11% Hispanic. Deaths, 78.38% white, 18.02% Black or African American, 2.25% Asian, 1.35% multiracial, and then ethnicity of deaths, 98.5% non-Hispanic, 1.44% Hispanic. Long-term care facilities, it's again a challenge, but this includes both Saturday and Sunday. 43 additional residents, 9 additional staff have tested positive, and 4 additional deaths. And again, that number lags behind what we report each and every day, as we have to identify where an individual is. But this is what COVID-19 is. Folks who are working in these facilities are working really hard, and to their credit, we come through and we test everybody, and a whole lot of staff may have the coronavirus, a whole lot of residents may have the coronavirus, and the staff doesn't walk out. It's a dangerous situation, and they stay and they help. We work directly with them. Norton is working with them. And we're providing testing. If they're signed up for our system, we're providing PPE, and Eric Freelander is going to talk here in a minute about the enhanced payments that we're providing many of these facilities, especially those that are assisting COVID patients. But again, just one major area of challenge that we continue to work through, and we know that this is where, in Kentucky, COVID-19 devastates us. So we got to expect there's not going to be visitation in the near future. We got to make sure that we continue to use every single step to protect those in these facilities and make sure that we are doing our best every day. I want to talk about testing very quickly. There are still, on testing coming up this week, spots available in our Kroger partnership. We now have so many different locations that are up, and they change. Sometimes they're just a couple of days. Sometimes they're open for longer. That we now have, this is our website, and this is CHFS's website, but we have one location that you can go to, and I take it that this is also linked on kycovid19.ky.gov, because everything has to be on that website. This is where to go to see where it is in your area. So for this week, Ashland and the entire area around Ashland, you have a bunch more spots that you can sign up for. We want to use every one. On Tuesday, we have 200 additional spots in Ashland. On Wednesday, we have 350 additional slots in Ashland. And on Thursday, we have 369 additional spots in Ashland. Let's make sure we use these tests. This is an area that we know has been hit, and there's an area surrounding it that we haven't had enough testing. Please take advantage of it. Local leaders, please reach out and push people to come and to get tested. State senator from the area had specifically asked us to locate there. We were excited because we already had plans, and I know that she and others will do their very best to encourage folks. Louisville, filling up, but there are still 126 spots left on Friday. in the Kroger location. Lexington, 206 spots left this coming Friday. In Bowling Green, 220 spots left this coming Friday. Walmart in Louisville is doing about 200 tests a day. They can do more. So if you're 18 and over with symptoms, or first responder or others, the Walmart location right outside of Newburgh at Bashford Manor is open. And then Walgreens in Lexington doing about 106 a day, but they can do more as well. Again, 18 and over with symptoms, you can sign up at that spot. Hazard, continuing to do a lot of tests, have the capacity to do more than 150 a day. They're going to stay open, I believe, Monday through Friday, 8 to 6, but I'd check on this. That's Primary Care Center. There in Hazard, they are available. Make sure that we are using those tests, and that actually isn't even using the state's testing kits. They've arranged with a lab called Solaris that is also in Kentucky. So again, we want to see and we want to encourage these new sites to open up. And remember, we can increase testing capacity on the state side as much as we want, and we're working to do that, but you have to show up and take the test. It helps keep you and your family safe, and we really need, especially as we move into healthy at work, for people to get tested. That brings me just to the piece that I need to mention again. It's that we're having a number of no-shows. We have had about 50 people per site on the Kroger side not showing up. We're in a worldwide health pandemic, something that can be deadly, that you can be asymptomatic and potentially spreading it to other people. That's why I wear a mask. But to sign up to take that slot and to not show up, we can't be doing that. Need you to keep the appointments that you sign up. And these drive-through facilities that are open to everybody, it's very important because, remember, we have to test those that are sick. We have to test our first responders, our healthcare workers. We need to have a channel for businesses to send people who show up with a fever or otherwise not feeling well. But then we also have to test the general public because so many people can be asymptomatic, can be walking around feeling fine, that have the virus, spreading it to other people. So we told you a long time ago that you ought to treat yourself like you have it, because that helps you make the type of decisions to be a good neighbor and not to infect someone that you would because you're asymptomatic. And this is the way to do it. It makes sure if I cough or if I sneeze that I'm not hurting anybody else. So I choose to wear this. I wear this when I'm out. I wear this until I walk up here and take it off. It's important. It's how we take care of each other. Don't do it for me, unless that's the reason you'll do it, then do it for me. But do it for everybody around you. Do it for that person maybe in their 70s, 80s, or 90s that might be at the grocery store, that if you are asymptomatic, you could spread it to. Do it for your kids that are at home so that you don't bring this into their home. Do it for everybody around you. Do it to live out your faith, loving your neighbor as yourself. This is the type of thing that we've been doing so much to help each other. Let's make sure that we keep it up. Small thing to make sure that we can start being healthy at work. All right. Next, I've asked Secretary Freelander to talk about two areas that fall under his cabinet. Number one is some of the things we're doing in long-term care, and then number two is child care and some of the areas where we're providing different payments, different ways to help people to keep going. Secretary Freelander.
Wear your mask even if somebody calls you Hannibal Lecter, just to know. During the social piece,
only the governor.
during the social piece, Kristen Herron was up. And this being a small state, I need to give her an extra little shout out. She's known as Tiny in Louisville. She is part of the group that goes out of St. John's and actually goes into the homeless camps and serves those folks that are there, and is a part of a whole big community in Louisville that really does a fantastic job working with folks who are homeless there. So Not only did her Mima survive and do well, I think she comes from a tough line, and she's tough herself. So thank you, Tiny. So long-term care. Obviously, this is one of the areas where there's a great deal of challenge within that community. We've seen that across the world, we've seen that in this country, and we've seen that in Kentucky. And we have tried our best to respond to the situations that are there. We've started our long-term care task force group with medical directors from across the state. We have worked with our partner at Norton's. They've started doing some strike teams and some testing in various facilities, and that began last week, and it's been very successful. So we've started doing some things that we hope are going to make a big difference in our long-term care. The other thing that we've done, and as I've looked across the country, I think we've been leaders here, as we've been leaders in so many ways. We were one of the first to shut down visitation. The other thing that we've done is acknowledge that there are some very specific challenges in long-term care. And what we've done is we've allowed for a rate. We've increased the rate for if a long-term care facility is taking care of a person who is COVID positive. And we've added $270 a day on top of their base rate to help them take care of a COVID positive patient. We've done that because we think it's important to align the incentives. We want to make sure that people get tested, and we want to make sure people in long-term care get tested. And this is one of the ways that we hope we encourage some of that. We have also, and I have not seen this in other states, doubled the amount of bed hold days. Now, this is a kind of technical piece, but it's how long they hold a bed open when somebody goes into a hospital, and we've doubled that in this state. And we've gone from 15 to 30 days. It's a big increase. Another thing we've done is we've changed the way that we're looking at long-term care eligibility through Medicaid, and we've made that a much easier process. So what would take 2 to 3 months formally is now hopefully just going to take days. And we're doing this as a part of the response to long-term care facilities. They get hurt by non-elective surgeries either. Some of the folks who would go into rehab and would have Medicare making payments, they don't see those folks anymore. So they have their own special challenges, as well as challenges for making sure that their personnel stay, as well as the challenges that we've seen across, again, this country of getting PPE for their staff and residents. So we're trying to acknowledge that. We've had good discussions with long-term care associations. They may have some slightly different ideas than we do, but I think we're all on the same page of making sure that we take care of that industry so that industry can take care of the folks in their care. Infection control, when we go out, that's what we look for. Now, we have fewer eyes there. We don't have as many inspections. We don't have the long-term care ombudsman going in. We don't have family members going in. So this is the time that this industry and us can demonstrate we are going to be faithful stewards with those folks in our care, and I think we will be. The second piece that the governor asked for me to talk about, which is kind of on the other end of the spectrum, is child care. And child care is a critical component to this state. And we've struggled for a long time with having the best child care, enough child care. We have what we call child care deserts. So the things we've been trying to do is to make sure that we don't lose capacity in child care. So there are a couple of different programs. One's called the Child Care Assistance Program, or CCAP, and the other is the CARES funding that got passed by Congress. And I can boil it down really quickly. About 17% of the capacity across the state is paid for by that CCAP program. We are taking what was the census of the previous month and making sure that we pay those facilities based on what that census was, so that we can make sure that when we come back, when we start to open up again, that we won't have lost capacity in child care. We've asked limited duration centers to open up. We asked the YMCAs and other partners to work with us to open up for emergency responders and other folks that would need that in order to respond now to the COVID crisis. And they have. And so we want to make sure that we, again, reimburse them appropriately. So we've taken some of those funds and blended them together to make sure that whatever they are charging, and they've been very fair about how they charge, that we're able to pay them. We're also going to offer them what we're calling a hero bonus for those workers who are working in those limited duration centers. another like 1,500 per person in there, so that again, as a one-time thing, we can help support. When we've asked somebody to help us out, we need to support them too. And so that's what we're doing. We're still doing some training when they need it. We're still going in and doing some inspections. We are still supporting those child care development associates is what they're called, but they're the people that work in child care. And so we're continuing to support those folks when we can, and we're taking applications for those folks who want to continue their education and get their certification in their programs. So we're trying to do everything we can to make sure that we maintain the capacity that we've had, because we know we need more. And so we're going to make sure that we don't lose any through this, or as best we can not to lose any. And those are the pieces that we're trying to do. And I'm hopeful that we'll do something in this state so that when we come out the other side, we'll be even better and in better shape than when we went in. Thank you. Thank you, Governor.
All right. We're going to get to questions a little bit earlier than we normally do. And then tomorrow, we're going to ask Dr. Stack to talk about Phase 2 of healthcare reopening, as that's coming on Wednesday. We'll go over some of the specific guidance that we'll have out there for certain industries on May the 11th. It'll probably just be telling you where it is and answering questions, but it will be out there a full week before, so people have it. So today, we got Shelby Smithson, we've got Monica Harkins, Karen Czar, and Joe Sanka, and then I have some questions here as well. I'll start with one of these. Are restrictions planned to be lifted for visitation on non-COVID cases? And are there plans for families within critical care end-of-life situations who may be unable to see patients within hospitals? So there are exceptions to visitation. Well, let me start back. Because of how vulnerable certain populations are, there is going to continue to be no visitation at our long-term care facilities, and there's going to be very limited visitation, I know, in our healthcare facilities, but there are exceptions for end-of-life situations. As you look even at the President's plan on reopening America, and by the way, we are following that plan. I know there are those that, well, anyways, we are following that plan. It asks in its terms those over 65 with heart, lung, or kidney disease or problems to still shelter in place is the term that they use. So it's really important as we go to Healthy at Work that we protect the most vulnerable populations. Joe.
So there was a very large protest at the Capitol yesterday. Give you a chance to react to anything that you heard that was said there, or things that you saw there?
Well, you know, all I ask that folks did, if they disagree, is to do it safely and make sure that people who were there would be protected. What I have heard is that speakers and leaders and even state representatives or state senators asked people to take off their masks, told people that social distancing is optional, and one even said they're not going to take the vaccine when it's created. That's just reckless. We're living in a worldwide health pandemic that can kill so many. Look at what it's doing in our long-term care facilities. You don't think at least one of the people who might have been there, who was encouraged to take off their mask and not socially distance, could pass it on into one of these facilities? Again, it's okay to disagree. But if you are a leader that people listen to, be responsible in how you do it. Be responsible in how you go about it. So if people want to protest and be heard, do it in a safe way. You want to do it in your cars, honking, putting signs out the window, then and you're just in your family group, you're going to be okay. Because, listen, whether you agree or disagree with you, if you disagree, Whether you agree or disagree with me, I want you to be safe. Whether you believe COVID is real or not, I know it is, and I want you to be safe from it. So just do it in a way that won't spread the virus. Remember, you may feel fine, but if you're asymptomatic, you're just hurting everybody around you. Karen.
Governor, could you clarify for businesses or organizations that are opening on a date that you said that they can, say, churches on the 20th, are they required to submit a plan, or is it you're trusting that they would follow the regulations?
So the question is for businesses or organizations when they reopen, are they required to submit a plan? So they are not required to submit a plan, but the plans are what we use to help us working with either organization groups, associations, or industry groups to come up with the industry or organization specific requirements. So what you'll see, and we'll have it up on Monday, is we'll have, can you put up the top 10 healthy at work rules? You got these that apply to everybody. But on top of that, depending on the industry, you have some additional rules or a couple of variations. Now, manufacturing is a lot different than construction, just in where people are and how they interact. And office-based services are very different from that. So there's going to be, I believe we've got 4 or 5 different proposals, recommendations from faith-based organizations, which you'd asked about. We've already had, Rocky has been on a number of those calls. I'm going to be on a couple more this week. So again, it's about getting input. But I will say that just about everybody that we've been working with has been really thoughtful. Really thoughtful. And what I've heard from a lot of the faith-based areas is, we're glad we hear about the 20th. We're not sure we're going to be ready for the 20th, and that's okay. So follow your faith leaders. If they say not the 20th, but sometime after that, it's because looking at their facility, I mean, we go from small churches to huge ones. And based on their ability to get what it takes to do it safely, it may take a little bit longer. But let's make sure we're doing it safely. Let's see. Does the governor have a comment about Representative Savannah Maddox saying no one can force her to take a vaccine for COVID-19? We're in the midst of a worldwide health pandemic. This is a highly infectious virus that if it gets to the wrong person can be devastating. Hi.
Hi, and then my question, going off the protest as well. So obviously we saw mass gatherings over Easter weekend. They were citing down license plates. The protest yesterday was a mass gathering. Were there any citing going on, or can we expect any citing from that event?
The question is anybody from the mass gathering, the protest on Saturday, going to be cited? We'll see about steps that are going to be taken. You know, in this job, you got to do the best you can to try to protect people, try to make the best decision in each circumstance to not encourage more people to do something that's dangerous. On Friday, I said that Purdue has not been responsive. Has Purdue changed responsiveness since that Friday news briefing? Have any other meatpacking plants been asked to close for cleaning other than the 2 facilities mentioned Friday? So after my comments on Friday, Commissioner Stack got a call and had a productive dialogue with Purdue representatives. They expressed their commitment to collaborate, and hey, I like that we had a good conversation. But what I'm going to need to see is action. I'm happy that there's the dialogue going on. I do want to see some steps taken moving forward to protect folks, and I hope the company will work with us on that. Tyson and Henderson is closed from April 30th through today for a deep clean and to re-engineer facilities to help improve social distancing and other mitigation strategies. See, that's a good step. Even with something that's this important to the food supply chain, we cannot allow people to walk into an unsafe environment knowing that this is there. Specialty Foods in Owensboro also announced their closure. They plan to close until May 11th. JBS, case count's now risen to 57. They're still working on their plan and have not yet closed. Louisville's working with JBS, exploring the plan, possible closure, and benefits of the closure. Shelby.
So it's been a week now since the first reopening healthcare. Has there been any impact that you've noticed or any changes now to phase 2 because of what you've learned from phase 1?
So the question is, it's been a week since the very first phase of the healthcare reopening. Have we seen anything out of it, and is it changing our timing for phase 2? Typically, we would expect about 2 weeks to see if there is a spike of cases. Based on how we're phasing this in gradually, I don't expect that we will see that, but we'll be looking for those nuances and looking at where people may have gotten infected. So doing this in the healthcare community helps us start in a very controlled way with professionals that understand infection better than anybody else, but that can also report to us if there's been an infection in that context. A doctor's going to know if their patient ended up testing positive later, or if that physician or nurse or anybody else, chiropractor. And so as long as we have that communication, this is an area where we believe we can get very good feedback. But phase 2 is set to begin this Wednesday on its date. We know that our healthcare providers are critically important to building up our testing capacity and giving them this lead time for everything else. It's going to have us in a better position as we move forward. Does word of at least 33 coronavirus cases at the federal medical prison in Lexington cause any rethinking of timing for easing restrictions? So this is a federal prison in Lexington that's got a number of cases with inmates, and we don't have a whole lot of information on that because it's a federal facility, and also of the corrections officers. We've reached out. We reached out directly to the federal government through a couple different sources, talked to FEMA about this as well. One area, because, again, these are folks in federal custody that we want to try to be active in is the employees who are Kentuckians and who are going in and out of that facility. But no, the facility having those cases itself doesn't change any of the thinking of our timing, because, again, we are seeing at worst a plateau. Now, it's still dangerous out there because at any time it could spike back up. And why are we at that plateau? It's because of the sacrifices that you made. So let's not let down our guard. This battle is far from won, but we have done such a good job at sticking to the rules that we have had for Healthy at Home. It gives me hope. It gives me faith that we can be healthy at work. Joe.
The Muhlenberg County Health Department, they announced yesterday that there were 46 new cases, confirmed cases in that county. I'm assuming that's from
Green River.
From Green River State Prison there, and has been reported.
And meatpacking.
Yeah. And meatpacking.
Yeah.
Okay. Is the goal to test every single state inmate and staff in a prison in Kentucky? And secondly, is the goal also to test every person in a nursing home and every employee in a nursing home?
The question is, and first, Green River will have the full report tomorrow because I don't think what they announced is necessarily all of it. It's going to be, we think, a tough report about how COVID-19 has moved through that state corrections facility. We've now tested everybody at Green River, all the inmates, all the staff, I think everybody who even comes in, whether it's, I think Aramark is the food provider, as just an example. So our goal isn't to test everybody in every prison because of our overall testing capacity, and no state's really doing that. Ohio had started and isn't doing it now. It's where we know that there is an outbreak, having a rapid response that maximizes resources to that location. In our nursing homes, we are doing significantly additional testing. And yes, I would like to have a test for every single individual in one of those facilities. Now we're going to have to triage it a little bit because there are assisted living facilities, and then there are significant care where people are getting round-the-clock help, and we want to make sure that the most fragile are being tested as early as possible. I know Secretary Freelander is working on that. Karen.
We're still getting unemployment emails,
Right.
May from April, which we know you're dealing with next, but there's a few in particular still from March who are saying they've been waiting almost 6 weeks, and they're not falling into that category, which you mentioned, I think on Friday, of we need ID or your employer hasn't verified, and they said, oh, that's been approved. One in particular is getting a call at 6 o'clock or something every day for 3 weeks saying, we're gonna call you, and then nothing. They don't know what to do at this point.
Yeah. But it's, more questions on unemployment, and those two individuals, make sure we get their names before you leave. We in the very least, want to help them out. So in March, people who filed in March, we're now down to the tough claims. And they would be tough claims outside of this as well. There are more of them because there are more people who have filed. While we have been able to loosen the laws a lot, we were one of the very first states to push for including folks who traditionally wouldn't have been your independent contractors, barbers, cosmetologists, all of these different groups. And I believe that we have been, at least according to our outside vendors, one of the better states for processing claims. But we're still down in March now to the ones that are going to take time. It's because of a couple reasons, unless it's an error in another. But the reasons now are either filling something out wrong, and that's one where we need to talk to the individual to see if it was just a mistake. But if you check some of the wrong boxes, you might not qualify for unemployment because those pieces of the law are still there, or if your employer is contesting it in any way. We'll get another update probably tomorrow, if not on Tuesday, about exactly where the numbers are. Now we know where they are in March. We ought to be talking about where they are in April too, because we're now in May. Monica?
I know you just said we'll get an update on those claims, but do you have a goal for this week? Maybe not in regards to unemployment.
Yeah.
But
Well, I think our goals for this week are number one, to get all of the guidance up for businesses that start on May the 11th. We want to get that up on Monday, and we want to be talking through it a lot at these in the coming week because, again, healthy at work, we got to be healthy, and we got to do it right. And the difference between doing it right and not doing it right can be the difference between life and death, and I know that when we make these decisions. So we're going to be spending a lot of time on that. We're then also going to be working more heavily with those that are in phase 2 of the Healthy at Work program. And so that'll be retail and houses of worship to try to get that out even further in advance. My hope is that we can get that guidance done maybe even by the end of this week. So Healthy at Work is going to be a big focus of this week. Phase 2 of healthcare is going to be another major focus. And then we're going to continue to try to ramp up testing. Then part of that is just letting people know where all the testing options are and how they get to it. But we're going to have some new partnerships that are opening up. We hope we can announce them this week. We're working on one in northern Kentucky to have a regular, stable testing presence up there. And then, of course, we'll announce 2 new testing sites, or up to 4 new testing sites, probably 2 new testing sites on Wednesday, like we do each week. Shelby?
As far as field hospitals that have been set up throughout the state, have any of them been used and do you expect them to be?
Question is on field hospitals. Have any of them been used and do I expect them to be? 2 were created, one by the University of Kentucky and one by us. That's the one in Louisville at the fairgrounds. We are going to keep the one at the fairgrounds fully intact and ready. It has not been used yet, but we have seen the situations where we know it's needed. So it's needed for 2 reasons. Number one is you look at what happened at the long-term care facility in Louisville that had to be evacuated. Thankfully, Norton had a wing that they were able to create very quickly for those individuals. That is not always possible when you've got 20 positive folks that need significant help and care. You might not have a facility around that's ready to take them as fast as they need. This is a turnkey solution that can open up and you can have that help, and I would hate to not have it if we needed it. But the second thing is as we allow healthcare to open up, we're going to reduce the open bed capacity in Kentucky, and that means if there is a surge, it'll be needed as we have to take the steps again to preserve more beds around the state. I'm glad we have it. It's there and ready. And if at the end of the day we didn't need it, thank God. It means that we've done better in this pandemic than we could have hoped for. One more round. Joe?
So Governor DeWine of Ohio has backtracked on his face mask order. Do you have any, is there any change to your order on face masks, or has nothing changed there?
So I believe that Governor DeWine and I are in the same place in that employers are going to be required to have them for employees healthy at work. If you're going back to work, you have to have one of these. For the general public, not at work, I'm asking. We are highly recommending. I am urging, if I have to, I will plead to wear a mask. But nobody's going to be fined. Nobody's going to be penalized. At the end of the day, this is your decision, but it's one that impacts the lives around you. Never before in my life have we had a time where what you are willing to do and the decisions that you make can impact people more than right now. Your refusal to wear a mask could result in somebody dying. Your refusal to wear a mask could bring that, you could get it and bring it home to your kids. Refusing to wear a mask, it could get in a long-term care facility, it could get in a different prison and do real significant damage. If you believe that we're supposed to love our neighbor as ourselves, and you know that you could potentially be carrying a virus that can harm people, why wouldn't you be willing to do this? Again, it's ultimately, if you're out in public, if you're not involved in Healthy at Work, it'll be your choice. But I don't think it ought to be a very hard one. Karen.
Governor, could you respond to yesterday's Federal Court of Appeals decision?
Yeah, yesterday the Sixth Circuit put out a decision that while I believe it was fed untrue facts, supports the exact policy that I've had in place. What we did, because of how dangerous this virus is we ultimately had to stop all mass gatherings, including in-person worship service at our houses of worship. But since day one, we have encouraged drive-in services, and we have encouraged virtual services. In fact, when there was a lawsuit with Louisville, we submitted a brief that said, my order allows drive-in services. I stood up here before Easter and said, please, please take advantage of either the virtual or the drive-in option. I've been on calls with county judges and mayors about how they were going to do multiple churches at the same location doing this, and we were just talking through to make sure it was done well. I've talked to faith leaders about how they have done it. So I think it's a good decision in that it says exactly what we are. No in person, but you can do drive-in services. Now, the church that filed the lawsuit somehow convinced the court that we hadn't allowed them to do a drive-up service. That is not true. No one who came to a drive-up service and didn't get out of their car was cited or got a letter or should have gotten a letter. So my question is, they went to court. They say it's a victory. Are they abiding by it? Now the Sixth Circuit has said, okay, no in-person but drive-in, and they say, hey, we won. Are they going to abide by it? I just hope that they do. Again, I know I've answered a lot of questions about one house of worship, but every other one across the Commonwealth has done what it takes to protect their people, and for that I am grateful. Think about it. I mean, we talk about different things that people argue about all the time. And that could be religion, it can be arguments between denominations, it can be arguments between different types of faith. When have we ever come together 99.99% and done the right thing for our people? And I know that people really want to get back, and that's why we're working on May 20th. I hope that gives everybody a timeline, gives everybody a little bit of hope, gets them excited, but gives us time to do it right and to do it safely. And what we've seen is that 99.99% is all. Sending in plans is working with us, wants to do it right. So I'm fine with the decision. It's the exact policy we've had in place. Monica.
You talked about how that when we start to reopen, the world will still look a little differently.
Very different.
With graduation, Fayette County Public Schools announced they're saving dates in July, September, and December at Rupp Arena for graduation. Can you comment on that? And do you think that something at Rupp Arena is gonna be able to be a social distance type of graduation?
The question is, I've mentioned that the world's going to look very different until we get a vaccine, and it is. And it is. If you looked around this room, everybody but me and Rachel are wearing masks, and that's because I'm talking, and facial gestures are so important for sign language. And then Fayette County Public Schools, which I'm a graduate of, has apparently reserved Rupp Arena for dates in July, September, just a number of different dates going in December. That's fine that they're planning in advance, and I hope that that's possible during any of those periods. But I know what they're doing is they're planning all contingencies, and I understand that. Getting everybody together at Rupp Arena at the same time in the world we're looking at right now isn't necessarily a good idea, but I know that's why they've just reserved dates. And if we get an early vaccine, though they're talking about the earliest being January, and I hope that happens, if there is a more effective treatment, or and we do not expect this goes the route of SARS and just starts dissipating over time, then those will be good. It'll be good that they had those dates. Shelby, last one.
So moving forward, because of how large the protest was yesterday at the Capitol, do you expect there to be enforcement like the taking down license plate numbers and calling each individual asking them to quarantine or anything like that?
Well, we'll see. But I not wanting to spend too much time on a protest that, you describe it as large. That number of people, many coming from out of state, are always going to disagree with something you do, and that's okay. I believe when you look at how we flatten the curve, how even a conservative think tank at the University of Kentucky has said that we've saved thousands of lives, and that we shouldn't focus on the 1% that don't believe COVID-19 is real. We ought to focus on the 99% that have sacrificed for one another to do the right thing. And my hope is that we have the type of positive social pressure that tells folks that showed up there and didn't wear a mask that you're putting other people's lives at risk. I think we've already seen a couple stories coming out about how some people who came weren't from here and certainly don't share common core beliefs that we do, that everybody is important and that everybody counts. All right, so again, thank you for giving me a day yesterday, but I'm going to be here. We're going to get through this together, and I'm going to make sure that I'm here each day, or just about every day, and maybe need one more Saturday at some point, because we still have a ways to go. But you are doing so well, and I'm proud of you. I mean, you are defeating a worldwide health pandemic. You are saving lives, and you're doing it better than just about anywhere across the country. So being somebody that just did it, take a little time for your own mental health. Take some time off. When you need to, turn off all the news about this for just a little bit of time. Spend some time with your family. Get some exercise. Until we get a vaccine, it's going to be stressful. And there's going to be anxiety even when we can do some more things. There might be more anxiety when we can do some more things. And to everybody out there that wants something else in phase 1 or phase 2, we'll keep working with you. And if you're upset you're thinking in phase 1, again, we'll work with you. But we're just trying to make the very best decisions we can to protect everybody around us. This is temporary. And we don't know exactly when it'll end, but we know that it's temporary. And I believe, since we are strong enough to defeat this virus in a way that nobody has ever seen, we are strong enough to rebuild our economy. We are strong enough to come back better than ever. And let's come back better than ever. More kind, more compassionate. We are one Kentucky. We are Team Kentucky. And I believe we're more united now than ever. So let's continue to do this. Let's continue to follow those rules. We'll get through this. We'll get through this together. We'll see you tomorrow at 5. We're going to be back in the Capitol to give you that familiar backdrop once again. We're going to leave you with another version of My Old Kentucky Home. This is put together by Woodford Reserve with another famous Kentuckian.
Feel the sun. this summer the people are gay. By and by, hard times come a knocking at my door, and my old Kentucky home, good night. Oh, weep no more, my lady. Oh, weep no more today. We will sing one more song for the old Kentucky home, for the old Kentucky home, far away.